Going to show you our new continuity of care plan identification tool. So in the GP contract going from the 1st of April 2025 is the need to identify patients who will benefit from a continuity of care plan. So this is patients who may be under a lead clinician. It may be that they're under routine clinician, a lead clinician for routine work, but maybe I'd see other GPs or clinicians for acute care. But it's a way of identifying those patients and then also what the adjustments are or what the care plan involves. So I'm going to show you how to add a patient onto a continuity of care plan, but also then how to identify when a patient is or has a care plan in place. So the first thing we're going to do is just go to a patient. So this patient, Mickey Mouse, we're going to add to a care plan, continuity care plan. So the first thing you're going to do is go to all templates. In the middle here, it's been added under clinical tools, continuity care. You'll see there's not a lot on there. That is to try and keep it as simple as possible. We really just need to know if they're under clinician and then what any additional needs are. What you'll see down here is if there's any information already in place for this patient. To put the patient on the continuity care plan, you're going to select this tick box here, which is putting the patient on complex needs plan. And then here you've got two boxes, one appointed clinician and the next one is additional needs. You'll see by clicking the plus that we've already had a couple of preset notes, that's GP names, and also any additional needs. So it may be that the patient needs double appointment or acute appointments with any clinician, but all routine to go to the lead clinician. And you can add free text in there as well. You don't just have to stick to what we've added as a list. Once that's in place, you're going to save the record. I'm just going to save it. And then when you go into the next time, or whoever goes into it, reception or down your clinician, the first thing that's going to pop up is this. Again, straightforward box. It will only pop up on those patients who have a plan. It won't pop up on those patients who don't have a plan. And what you'll see is very straightforward, that the patient's got a continuity of care plan, who their appointed clinician is, and if we've put any additional needs underneath. That means that reception will see this, so they'll be able to identify, so this patient is appointed clinician is Dr. Lawal. Ideally that the patient then will get booked with Dr. Lawal. It may be that the additional needs under there might have said under appointed clinician for routine, can be seen acute by anybody for acute. So that would be one of the boxes that we could add on there. But that is what will show up and how you'll be identified. The other way is by this red dot over here. This red dot will show you that this patient has a continuity of care plan in place. This is your identifier under the demographics. So there's a couple of ways that you can find it, but as I said, when you open up the record, if the patient has a plan, it will identify it to you. So you can make note of what's in that plan. And that is how you add and view the care plan. If you want to remove the care plan at some point, you can absolutely do that. What we would need to do is then remove that care plan code. So you would find the care plan that you've just put into place, and this code here is the one that would need to go. So you can just then mark that in error, and then that care plan would remove.